Okay, I think this is good enough. Nice group of people here. Welcome, everybody. This is the Feather webinar talking to you about public health insurance. We'd like to tell you a little bit more about how you can make the most of your public health insurance. And to tell you a little bit more about who we actually are, probably many of you are already Feather customers, but we are on a mission to make insurance easy and accessible, primarily in Germany, but really all around Europe. We're also available in Spain and soon launching in France. We're doing this by having really easy online signups for insurance, offering great value insurance, and then we understand that as an expat moving to a new country, it isn't really all that easy to understand the system right away. So we really focus on providing excellent customer service as well. And I'm now realizing that we should probably introduce the speakers. And I'll just jump in myself first. My name is Julian. I've been at Feather for about 5 years because I'm really excited about helping people and also excited about insurance. My official title is Head of Insurance, so I take care of a variety of different insurance verticals. I'm an expat myself, so I know the pain. And that also goes for Basti and Sabine. Maybe you want to say a little bit about yourself.
Yeah, cool. All right. Hey, everybody. I'm Basti or Sebastian, here at Feather for about 3 years. Also expert, moved away from Germany actually, but have also lived in the US for a year. So yes, knowing the pain is definitely one of the things. And yeah, in Feather, my role is basically a public health lead, but also in general health insurances. Yeah, and team leading basically. And yeah, the last but not least, Sabine.
Hello there. Yeah, my name is Sabine, and knowing the pain is definitely was my most the motivation to join Feather more than almost 2 years ago. I'm working with public health insurance primarily, and living in Germany now, I understand all the problems that you might have in understanding the German healthcare system, because most part of my adult life I was living in Spain before as an expat as well. So far to me.
So covering a little bit about what we want to talk about here, we are trying to compress as much information as possible. We don't want to keep you longer than needed, but most importantly, at the end of this session, we'll also do a Q&A and be able to answer some specific questions. But before we're doing that, we'll go into covering the coverage of public health insurance a little bit, how to find doctors, tell you a little bit about some of the hidden benefits of public health insurance that most people don't know. We'll speak about upgrading your coverage if you're interested in that, and then also cover cost, how to choose the best providers. And so that we know which topic we should spend the most amount of time on, we've actually prepared a little bit of a poll for you, which I'm going to launch here in a second. And this will give you the ability to basically pick your favorite area that you would like us to speak about. Just a second. So you should be able to vote now and basically express which topic you are most interested in. And don't worry, we're going to cover all of the topics, but this will just give us an indication what is most important for you. So we already have a bunch of votes. A few more seconds. There should be a little notification in case you don't see the poll right. 3, 2, 1, and I'll end the poll and we'll see the results. And we can see that a lot of people are interested in the coverage, how to find doctors, cost. So we'll try and give you some extra details on those topics specifically.
All right, so let's actually get started with public health insurance. I just wanted to mention we will also, we will obviously hear questions. You should be able to use kind of submit questions during through these activities on the right hand lower side, and we will kind of do the Q&A just in the very last moment of this presentation. Okay, so yeah, public health insurance, what is it? It's not only called public, but also statutory health insurance, and it's a government-funded health insurance scheme. So yeah, government and public health insurance, even they're half private, they're very connected, and they basically offer this comprehensive health insurance. Over 90% of the people living in Germany, not only Germans, but 90% living in Germany are actually signed up through this statutory health insurance. One of the best parts about that is probably that dependents are usually added for free. So not only children, but also spouses if they have low income. Yeah, and a lot of people obviously use that. Public health insurance is definitely a long-term option, without question. The cost of this insurance is calculated on the person's income. So it doesn't matter if you're very healthy or very sick, very old or very young. It really depends on income, and that way it's pretty fair to everybody. Public health insurance is also accepted to all visa types, visa renewals. That's also a question for lots of experts. So yeah, don't be worried about visa with public health insurance. Okay, so yeah, how can you find a doctor? It might seem not very easy, but here we get a little tip on how to do it. So there is a booking service online, usually with a provider. It depends obviously on the provider. We haven't mentioned yet, but there are around 100 providers in Germany. So every provider has a little bit of their own services. So yeah, but usually the provider enables that. But there's also a free online platform, as you can see written here. One of the favorite ones that we use a lot and recommend is Doctolib and Doctena.de. There's also a service called Video Doctor. Not all providers use that and offer that, but that's also pretty neat if you are sick and you can just stay at home and call your doctor right away. So yeah, what do you need to make an appointment? That's also pretty easy in public health insurance. So you get this electronic health card and you just present that directly when you go to your doctor. There's no upfront payment needed. Every details on you are basically saved on this little card. And if you have to go to the pharmacy, you also give them the card and everything is kind of digital in there. So that's pretty neat as well. What about coverage on public health? So in general, as we said, it's comprehensive coverage. So basically everything is covered. Just a few things that we want to mention. So if you can go to the general practitioner, regular visits are definitely covered. Emergencies, prescribed medication, maternity, childcare. So you can see the list is pretty long, and we will go a little bit more into detail in the further slides.
So sorry about that. I'll spare you the echo. So yeah, to go a little bit into the additional protection that is covered by public health insurance that is a little bit less known, specifically sick pay, which is paid to you when you're sick for a longer time period. So usually after 7 weeks. Before that, your employer pays your salary as they normally would if you have an employer. And then if you're self-employed, it works a little bit differently. You have to opt into receiving sick pay, which makes public health insurance slightly more expensive if you opt into it. But then you do also receive the benefits in case you're sick for a longer time period. And usually it's really great value. So if you don't have it included yet and you're a freelancer, we strongly recommend to add it. And then on top of that, it's worth noting that although sick pay is pretty good, it's just temporary coverage. So it will cover you while you're sick. In case you get disabled or you cannot work for a longer time period for other reasons, then you should definitely look into other coverage such as life insurance or disability insurance, which would then provide much greater protection, and it's also really inexpensive. If you're interested in that, Feather has some options available. And then on the other hand, long-term care insurance coverage is included in public health insurance as well. This is probably less relevant for most of you listening, just because the primary audience of this benefit is usually a little bit older, on average between 75 and 95. However, it's worth knowing that you have this really good coverage. So in case you do need long-term ongoing care, either at home or in a facility, public health insurance would also partially cover this. The reason that the coverage is only partial is because the long-term care cost is generally pretty high. It can cost several thousand euros per month, and there's a cap on how much public health insurance will reimburse.
All right, going over to family insurance again. This is me. So yeah, as we mentioned, the family insurance is free under some conditions. So usually children, for example, until they become age 25 and are studying, they are free. So that's a great benefit, obviously. Then the legal partner, so you have to actually be married, will also be covered if they have an income maximum until 505 euro, or depending 538. So there are some threshold differences, and that can change every year. But yeah, in general, like if you have a mini job as a partner, then you can be covered for free under public health insurance. Parents cannot be covered, unfortunately. All right, European health insurance card. You might have seen this little blue card, and it's actually just on the back side of your regular provider's health insurance card, and that gives you coverage in the EU for a short time stay, basically. And yeah, you can just travel. You don't have to get any further insurance. You don't have to pay up front, and there's usually no paperwork required. So having this card is a great benefit for you. The downsides of this card is that it's only for emergency treatments. That's why we basically say it's only for travels. It's restricted to public health insurance services. You cannot go to just any doctor. And yeah, it doesn't cover repatriation costs, search and rescue, or other accommodation costs. The stay period we usually define up to 3 months. There may be some difference, but that is kind of the rule of thumb there.
Yeah, since we understand that most of you are having family abroad and will travel abroad, maybe quite a lot, we usually advise to enhance your coverage abroad, because the EHIC is great for short stays in the EU, but it doesn't cover you outside of the EU. So if you want to have coverage worldwide, if you want to choose your doctor and not be restricted to the public scheme, then travel health insurance is recommended in any case. Even search and rescue costs are covered, and your return flight, if you have an accident and need a special medical return flight, this is covered, and even to have someone with you in the hospital. So there are so many advantages to have separate travel health insurance apart from your EHIC. And annual plans are available at very low cost. So if you're interested in that, we can help you with it. Let us jump back to what is included in your public health insurance in general. So we already mentioned preventive care, but what does that mean? Most of the people insured in public health do not really know this. So we consider this as sort of hidden benefits. There are a lot of exams, a lot of tests, a lot of screenings available for you, which you might not be aware of. In general, it's good to talk about that with your general practitioner and to see what's available for you and your age and for your gender. So available for everybody are skin cancer screenings, for example. When you're older than 35, you have regular medical health checkups available. Vaccinations as recommended by the WHO, and cancer screenings, colorectal cancer screenings, and even annual dental checkups are included in preventive care in public health. Let us have a look at the different groups of insured people. So for children, they are covered quite thoroughly. So there are the U examinations at certain stages of their development, vaccinations and screenings, and dental health is, and even orthodontics for kids are covered from public health. For women, you can have gynecological exams every year, breast cancer screening, and pregnancy. During your pregnancy, you're covered. After pregnancy, you're covered. So this is quite comprehensive what public health insurance provides and for women and children. Also for men, there are 2 screenings available, especially for men. In general, every provider offers this. There might be some differences, as we can see later on in this webinar. I mentioned dental. Julian, you want to explain what is not included in the annual dental examinations that are covered from public?
Yes, absolutely. So with the coverage a little bit, and I think overall to summarize it, the public health insurance coverage is really comprehensive. It's some of the best health insurance coverage that you can get anywhere in the world. However, the dental coverage that is included on public health insurance is relatively limited. You may not notice this immediately, but especially when it comes to tooth replacement, if you need a crown or a bridge, this is usually only partially covered by public health insurance, or maybe you're fully covered, but then you're only covered for a very, very basic kind of treatment that may not be what you like. And so if you are interested in getting dental cleanings more frequently, or if you're also interested to be covered for those more advanced treatments without having to make big out-of-pocket payments, and by big, I mean easily several thousand euros, then dental insurance can be really beneficial. Also for the smaller treatments, it is beneficial when it comes to things like filling material and such. If you've been to the dentist, then you may experience that you need to make some smaller additional payments, and then the dental insurance would also cover this as well. Dental insurance is really, really popular in Germany, and so that means it's a very competitive market, and what you can get is usually great value for money. And of course, shameless plug, Feather offers dental insurance as well, but more generally speaking, this is insurance that we would really recommend to you, because it can be super useful for unexpected treatments. And then there are some other options to upgrade your coverage as well. So if you ever need to go to the hospital, if you have additional hospital coverage, then this would cover you to stay in a private room if you don't like to be staying in a shared room, which most hospitals offer. And you can also elect to be treated by the head physician of that hospital, and those benefits are also available, just paying the hospital in cash from your own pocket. But of course, it can be a little bit more convenient having insurance for it. And then on the other hand, on kind of the outpatient treatment side, so if you're seeing a doctor or an eye doctor, for example, there are other packages available to upgrade your coverage. One that is particularly important is additional vision coverage, which can cover LASIK, so eye surgery treatment, and also glasses, because those are typically not covered by public health insurance. And then many of you said that they're interested in the cost, and of course the cost varies a little bit between the different providers, and then it also depends on whether or not you're employed or self-employed. So to put it simply, about 17.1% of your gross income on average is spent on public health insurance, and then if you have an employer, the employer will cover 50% of this cost, and a portion of this will also go to the long-term care insurance that I mentioned a little bit earlier. The exact cost depends on two factors. So for one, it depends on your provider, and then secondly, it also depends on your family situation. So if you have multiple children, it will be slightly cheaper, and if you don't have any children, it will be a little bit more expensive. And to just give a basic example of what it actually costs, if somebody has an average salary of around 48,000 euros per year or 4,000 euros gross per month, then the average public health insurance cost is around 680 euros. And then there's an additional cost for long-term care insurance. And again, these numbers would be split in half if you have an employer and they are covering 50% of the cost. On the right-hand side here on this image, you see a pay slip. Depending on your employer, it will always look slightly different, but if you dig into it a little bit more, you'll find the exact amount that you're contributing towards public health insurance and long-term care insurance on this document as well. And then giving you a little bit more of an outlook. So short term in 2025, based on the current inflation levels, it is expected that public health insurance will get more and more expensive. So already in 2024, some providers increased their rates, and many more have announced to be raising them in 2025, which makes it especially important to be on the lookout for those price changes, because those price changes give you an immediate right to terminate your coverage, and then you can also switch to another provider, which might be a little bit less expensive. So Basti mentioned earlier that there are many public health insurance providers, and the reason that there are so many is that the system is designed for those providers to compete with one another. So some will have slightly different coverage, others will have higher or lower cost, and then you can decide what is most important to you and select your provider accordingly. And then more long-term, the system seems to be under a lot of stress just because of the demographic change in Germany. So there are some rumors expecting that the total cost for public health insurance could increase to as much as 20%. But of course, it depends on many factors. So it's really difficult to make a good prediction. But we can probably assume that it will get more expensive.
Yeah, and one more point that Julian didn't mention here, and maybe I'm underlining that here. So there's also the option to join actually private health insurance if you have an income over 75,000 euros a month, or even 30,000 only if you're self-employed. And that can be a very good alternative, as it is cheaper usually than public health insurance, with in parallel offering better coverage. So yeah, a very good deal. So if you're eligible, definitely contact Feather, and we can hop on a call or discuss if that's a good option for you. Comparing providers made easy. So yeah, we are talking about comparing providers all the time. We at Feather offer basically 4 different big providers. When we're talking about public health, there's also private health insurance. There's more comparison about that. But yeah, we definitely recommend looking into the provider, the health insurance provider that you want to choose. And even if you are already on a health insurance plan, definitely makes sense to compare provider, because you might be able to save money or to just adjust the policy to your benefit, basically, because different providers offer different specials. And if you're maybe young and have a family, you should get on a different provider than you're single, but you like extreme sports or whatsoever. So yeah, different reasons to be on different providers. And then just mentioning again, the offering of private health insurance for those who are over this so-called private threshold. One thing about comparing is obviously calculation. On our website, for example, we have this price estimation, and just within 3 clicks, basically, you can get a pretty good estimate on what you will actually pay. This exists for public health insurance, but also for any other insurances that you can find on our website. I want to take a very quick break and just explain again that we're doing a Q&A session in a few slides. There already have been a few questions posted. Make sure to upvote them if they interest you, so that we can definitely tackle these questions first. We might not have time to tackle every single questions, but we will definitely read them, write them down, and at least in our post-call email to all of you with the slides and some more information, we will cover the answers to all these questions. All right, getting back on the topic, optional tariffs. That's you, Sabine.
Yeah. We've talked about comparing providers a lot now. I just wanted to add that switching between providers, public health insurance providers, isn't as hard as many people think, especially since we're expecting a price change around the end of this year, beginning 1st of January. Whenever your provider changes the price, you can switch within 2 weeks to another provider which fits your needs more or which has a better offer. So you can easily just sign up for a new provider, and you don't have to do anything else. The new provider will inform the old one, and everything will switch automatically. Another topic to definitely have a look into when comparing providers are optional tariffs. So many people aren't aware that public health insurance providers do offer optional tariffs. We have talked about the general coverage, the general setup for public health insurance, but you can tailor your policy to your needs. So, for example, if you are pretty healthy, you don't use your insurance pretty much, not a lot, you can opt in for a tariff that gives you a refund for not using the service at the end of the year. So there are different models available with every provider. we will send you an email after the webinar with a more detailed FAQ where you can look up all the tariffs that are available with the providers we work with and with the 4 biggest, so you get an idea. There's also the possibility to exclude services. For example, if you're not planning to be pregnant and you don't need maternity and pregnancy care, you can opt out of it and receive money directly and lower your contribution. You can also just make promise to your public provider that you're going to stay with them for 3 years, and then they're going to pay you back some refunds on your contributions. So definitely interesting topic to look into. As I said, every provider offers something different, so you will have to check with your provider what they offer or with a potential new provider. There is another way to get back some money from your provider, from the contributions that you've paid. Not only money, but also special rewards for a health-conscious behavior. So if, for example, you do all the preventive medical checkups that are recommended, you might get some dental treatments, or you might get some extra treatments for free, or even some cashback. If you do all the regular vaccination, if you're a member in the fitness, in the gym or in the sports club, or if you participate in health courses that are offered by providers, you can earn points and rewards, points that will pay out in real money, or the provider might subsidize part of your health-conscious behavior. So we can see on the next slide just a quick comparison from the 4 biggest providers. For example, Balmer gives you cashbacks for up to 150 euros per year. Or you can, like DAK, gives you a subsidy for a gym membership, or you can even get up to 500 euros subsidy for sports equipment. So again, those offers are very different in between the providers. Oh, yeah, I want to come back to the bonus program for family and children. So here it's especially important that you consider your needs and what you want, your plans for the next years, and what you need from your provider. So there are several providers who offer special bonus programs or special payback programs for families and pregnancy support. So this is definitely interesting for young families to look into.
All right, we're kind of coming to an end, so we're basically summarizing in a nutshell here. So yeah, the public health insurance providers have solid, or as we call it, comprehensive coverage for all members, regardless of their income. So the difference to private health insurance is it's not income related, it's only, it's not age or health related, it's only income related, what you basically pay, but the coverage is totally apart from that, so that's great. You can save quite a lot of money by doing kind of having a preventive health style, as Sabine mentioned. So definitely look into these programs, into these different tariffs. They actually give you a great advantage on a monetary wise, yeah. But keep in mind, the individual choice definitely depends on the provider that you have, and you might want to check if a different provider suits you better. All right, and then we're coming to the Q&A session. I think we're going to read out the very first question, the most popular question, and then we're trying to answer as well as we can and see what we can do. All right, the very first one is, how does the calculation of the sick pay works for freelancers? Julian, that's on you.
Yeah, I'll try and answer. So we have two factors essentially. So on the one hand, there is how much you pay for the sick pay, so how much it costs to get the coverage, and this is income dependent. And then as far as how much you get out of it, this is also income dependent. And then the way that this is calculated is typically that public health insurance providers will look at your annual earnings and then calculate an average from it. So if your income as a freelancer is fluctuating, then it will typically be based on this. But on average, I think it should cost somewhere between 20 to 40 euros per month for most people. And that may seem like a lot of money at first, but really for the coverage that you're getting, essentially being covered for unforeseen sicknesses for a longer time period, this is quite cheap compared to what you would otherwise be able to purchase. Then maybe I can just jump into the next questions. I sorted them by popular now, so just another reminder, if there's a question that you're interested in, please upvote those. And we'll talk about those first. There's a quick nice note from Lara here, just saying that she's enjoying our user interface, which we appreciate. Thank you for that nice comment. And then jumping on, going further down, asking about a meeting recording. Yes, there will be a recording, and yes, it will be shared by email with all of you afterwards. And then Christopher has a question about his TK card at the dentist, where the thing that I mentioned earlier happened. So the dentist apparently asked him, to pay something extra. As far as a dental checkup goes, an annual dental checkup, this should be free with your dentist. So if you're getting charged for this, then maybe ask why they're charging you this and have a closer look at the invoice. But it's pretty standard to be getting some extra charges, even for just regular fillings. Most dentists will apply some additional charges, and you can avoid those additional charges if you have dental insurance, in which case you can simply upload the invoice that you're getting from the dentist with the extra charges to your Feather account, and then you'll be reimbursed for those for this cost according to the plan that you have selected. Then we have a question from Anonymous, who's asking about the income threshold for private health insurance and who is setting this to begin with. Basically how it works is that the threshold amount is set by the government, and this has been increasing year after year. And in theory, private health insurance companies should be competing with public health insurance companies. But then on the other hand, there also need to be enough people contributing towards the public health insurance system. And to ensure the financial stability of the public health insurance system, there is an income threshold, but this income threshold only applies to employees. So if you're a freelancer, you could switch to private health insurance regardless of your income. And the comment that I'm reading here is absolutely right, especially if you're earning pretty close to the threshold amount of being able to be covered on private health insurance, then the cost for public health insurance can actually be quite high. And unfortunately, there's not too much to do about that other than just being happy to have really, really good health insurance coverage in case you need it. And then if you do make enough to switch to private health insurance, you can look into that and compare the different options. On another note, it has to be said that the free family insurance coverage that we spoke about for public health insurance isn't available on private health insurance. So especially if you're covering multiple people under your plan, even if the cost may seem high at first, it's actually still pretty good value. And then I'll just go on with the questions. Feel free to interrupt me, Basti and Sabine. There is another one from Manaye, which is asking about affordable coverage while searching for a job in Germany. We definitely have something for that situation. We call this expat health insurance. So you'll be able to find this on our website, and you can have this if you don't already have public health insurance. And then another question about private. Yes, we first webinars on different insurances, and we'll definitely have another one on private health insurance. But if you're curious about private health insurance, then you'll already find a lot of information on our website, and you can also always schedule a one-on-one consultation with an expert who will be able to answer all of your questions. Then going on with the questions, there is another one from Lara about the EU health insurance card. And if it's the same with the normal health ID card, yes, I think it should be the same. Basti, if I understood you correctly, then the EHIC card, the EU health card, is actually on the backside of your health ID card. So if you turn it around, you should be able to see the details there. And this is what you would then also show to the doctor if you're anywhere in Europe.
Yeah, and that is actually a great service, because in other countries, like in Spain, where I live currently, you actually have to order that card, and you have to kind of refresh it every few months or years. And in Germany, it just comes with your insurance card, because, yeah, I guess they understood that it's kind of a thing that it's really needed right now.
And then I think I jumped over a really important question, which is asking about covering pregnancy costs. And yes, public health insurance does cover pregnancy costs, and there are also many other benefits included for future mothers and also young children. So this is definitely a great option to have while you are pregnant. And if you don't already have public health insurance and are pregnant, be sure to try and find a way to get onto it.
Yeah, I want to add something there, because I have read this question with the signups for the webinar. So there is, with public health insurance, there is even the possibility to, when you live here in Germany and you're pregnant, but all of your family is living in Spain, and you will not be able to have this child and be alone, and you need the help of your family, you can request an A1 form from your public health insurance provider, and even have the childbirth and the first weeks in Spain. So things like this are possible through the agreement with Germany that Germany has within the European countries.
And there is another one about travel health insurance. Sabine, maybe you want to answer this one. I'll read it out. The travel health insurance also covers the US. Does it have deductibles?
So the annual plan that we are offering has no deductibles in any form, and it has worldwide coverage. That's definitely something that public health insurance cannot provide. And so the only condition is that you have to start the trip after signing up for the insurance. Everything else is covered.
Thanks, Sabine. And earlier you said it's really inexpensive, and you didn't mention the cost, but correct me if I'm wrong. I think this is just costing 18 euros per year, if I'm not mistaken. So really super inexpensive. And if you're doing any kind of traveling, this is a really good option. It's much better than buying it from your airline or somewhere else, just because it's typically cheaper getting it directly from an insurance company. But it may also be included with your credit card. So if you have a really, really good credit card, there is some travel insurance there sometimes as well. But there might be strings attached. So be sure to read the fine print on that if you are relying on it.
Yeah, but I can tell a little trick. So with your credit card, probably only your family is included, while with the annual plan that we're offering, you can include up to 7 people, which doesn't have to be your family. It can be your spouse and your 5 children, of course, but it can also be the girl you're living with, or the people you're living with, if they're under 21, or 1 adult and up to 5 people under 21. So, and all that for the price of 32 euros annually.
Thanks for that little hack, Sabine. And then another question about private health insurance. Some negative feedback when it comes to switching from public health insurance. So like I said, we'll have a webinar for private. And if you have more detailed questions, feel free to reach out to us. And a fun fact, Feather is actually taking care of the switching process. If you're switching to private health insurance and your public health insurance coverage company is giving you a hard time to switch, as they sometimes do, then we're there to help with that. Lara has another question about insurance in addition to Berufshaftpflichtversicherung for doctors provided by the workplace. What other additional insurance cover in particular? So if you're a doctor, then some other additional insurance, I think typically would be private health insurance. As far as I understand, a lot of doctors, if they are eligible, would be opting for private health insurance. And then aside from this, and this goes for everybody, not just doctors, of course, disability insurance is really, really valuable. And then as far as other insurance provided by your workplace, there's typically pension insurance if you have an employment contract, but this pension insurance is typically government pension insurance, so it may not be enough to cover all of your costs during retirement. So it would be a wise choice to look into pension insurance and pension plans a little bit more as well, to make sure that you have enough money to retire, or might even be able to retire early.
Yeah, another topic that has been raised a few times is unemployment. So in general, public health insurance is also the health insurance that is responsible for unemployed people. Depends a little bit if you have been employed before or not, and on the time period that you have been employed. But our general advice would be definitely talk to the job center. Usually, or sometimes they pay part of for the public health insurance, at least for a bit of time. So yeah, that would be your first point of contact. If you have very specific questions, you can of course also contact us about that. Yeah, and if you may switch kind of from being an employee to maybe a freelancer, then you also might kind of switch the scheme within public health insurance, and then you would be part of the so-called voluntary insurance. And in there, the minimum price is around 220 euros. Yeah, but the coverage again is perfectly the same, and it doesn't depend if you pay 800 or 200 euros.
I just want to add that, of course, if you quit your job and you've been publicly insured while being an employee, your provider will offer you a so-called Folgeversicherung. So it's a follow-up insurance. You can stay insured with public health insurance. They're not going to kick you out just because you're unemployed.
And then there's the question about coverage, and this one is specifically about glasses that are needed to work. I think here it depends a little bit. If you have an extreme vision impairment, then you might be able to get some coverage, but I think the typical answer is that glasses are not covered by your public health insurance. But the best starting point here would definitely be to get a checkup from your eye doctor, and then they'd be able to let you know your options, and you could decide what to do thereafter. Then there's a question about this one is also about unemployment, I believe. Essentially, in Germany, if you already have public health insurance, there's almost no way to be left without insurance. Typically, whatever happens, your coverage should continue. And if you don't already have public health insurance and are unemployed, then it may not always be possible to get onto public health insurance. In most cases, it would depend on your insurance history. And in such case, private health insurance or expat health insurance can be good options, both of which you can find on the Feather website. And there's also a recommendation tool, as we call it, which will give you health and other insurance recommendations based on your own individual circumstances. So you might be able to find an answer there based on your exact circumstances.
And as you mentioned, the Feather website, there you can also find more information about the bonus programs. So there's this question here, where to find the bonus programs. We have support page where you can get in contact with us, but you can also have access. You also have access to our FAQs, and you will find more detailed information about the bonus programs of each provider there. And but to modify your contract with the provider, you will always have to get in touch with your actual provider and arrange bonus programs or optional tariffs directly with the provider.
Then there is a coverage-related question. Maybe Sabine, this one could also be for you. Is therapy covered by public health insurance?
Yes, but it depends. If the therapy is prescribed by a doctor, it is covered. It might be limited. Well, whatever therapy is needed. So it might be for mental health, or it might be physiological therapy like a massage or other treatments. They are covered if the specialist says that you need it. And of course, it might be restricted to the number of treatments, and depending on your situation, you might prolong it. So this is decided on the situation, on your situation.
And then there's a question about the premium refund tariff reimbursement for unused services. And Sabine, if I understood you correctly, then this is absolutely also available on public health insurance, not just private health insurance. As I understand it, private health insurance typically has maybe slightly higher reimbursements compared to public, but if private is not an option, then you can definitely talk to your public provider or reach out to Feather, and we'll be able to point you in the right direction to learn more about it. And then there is a question about additional coverage, such as vision, bike insurance, and how to add them. So bike insurance, you can just navigate to featherinsurance.com and you'll find bike insurance there easily. And if you give us a couple of details about your bike, then you'll be able to purchase bike insurance right away. As far as vision add-on coverage goes, we don't have that readily available on the website just yet. But if you're interested, you can just send us a message to hello@featherinsurance.com, and we'll be able to help you further. Then let's see what else there is. It's a little bit difficult to read questions and answer them at the same time. What health checkups are initially covered by the public health insurance without additional coverage options? So I think there are many, as we discussed. It's a little bit difficult to give a straight answer. So the best answer is check with your doctor. But regardless of what the situation is, we strongly encourage you to do those preventative checkups. It's always better to do the thing like purely preventative rather than just waiting until it's a little bit too late. So yeah, just use the services that we mentioned, such as Dr. Lip or Doctena, to find a general practitioner if you don't already have one, and then they'll be able to guide you with the next steps. Then there is a question from Martin. Can Feather support me switching to private health insurance? Yes, absolutely. We didn't talk about Feather too much, but Feather is one of the few companies, I would say, that is offering public and private health insurance alike. And the advisors for working for Feather are actually providing independent advice. And the way we're doing is that nobody at Feather advising on insurance is getting any kind of commission, which is very, very different to what you usually see in the insurance space. So if you'd like some advice on private health insurance, by all means, get in touch with us and we'll check with you if it's actually the right decision, because although it can be cheaper and although it can offer good coverage, there are also many situations where public health insurance is actually the better choice, and it's really not so easy to see that all the time. So some individual one-on-one consulting is probably the best to answer all of your questions.
There's another question about travel insurance. So search and rescue, as I mentioned it's not included in your public health insurance. In Austria and France, the ambulance that brings you from the place to the hospital is included. But if, as mentioned in this question, in case you need a helicopter rescue in a ski trip in Austria or France, if you are outside of the tracks and the official areas to ski, you would have to pay for that. So that's another reason to get travel health insurance, because this is covered, and with the new tariffs that we're getting next year, search and rescue up to 15,000 euros is covered per trip. So the helicopter should be paid.
And then final answer, and then the rest we'll answer by email. This one is about switching between public health insurance providers and how to do that. Yes, you can do that through Feather, and the best way to actually do that is just again heading over onto our website, selecting the provider that you want, and then simply signing up for it. It should only take minutes to complete that, and then, as Basti said earlier, the cancellation of your current public health insurance will be done by your new provider, and there's not much that you have to do. If you have an employer, then you should let them know that you actually switched public health insurance companies, and that's all there is to it. And then that's it for tonight. As I said, we'll be going over the other questions by email, and if there was anything else that comes up that we didn't answer here, you can just reach out to us by email as well, or schedule a call. We really appreciate you joining this webinar. Thank you, Sabine. Thank you, Basti, for taking the time. And I hope you all have a great evening.
Thank you. Bye-bye.
Thanks a lot. Bye bye.